Dear ladies and gentlemen, thanks a lot for the invitation and for giving Slovenia the opportunity to speak. Slovenia has a long-standing commitment to advancing well-being and equity as central pillars of national policy and international engagement. Through initiatives such as the Slovenia Equity 2030 Agenda and sustained collaboration with WHO Europe and WHO headquarters, Slovenia has established itself as a credible and active partner in promoting values-driven, equity-oriented approaches to health and development. Since our independence in 1992, we have legislative obligation to assess policies for the health impacts. Slovenian Development Strategy 2017-2030 is strongly building on well-being principles. It has 6 key indicators linking different sectors and healthy life years as the first one, followed by PISA education results, risk of social exclusion, GDP per capita, employment rates, and share of renewable energy in gross final energy consumption. Strategies representing a traditionally sound grounding for a number of well-being policies already existing in my country. As for instance, the school meals policy initiated in the 1960s, covering 2 main goals: provision of healthy and nutritious foods for children, as expected, and to enable equitable access for the female workforce to the labor market, which was also a very important one. We could notice that also in other situations, in natural disaster in 2023, for instance, when major floodings destroyed many structures, we did not just look for the physically rebuilt homes, but also through directing public finance and efforts towards mental health organizations, look to rebuild the state of mental well-being of the people and trauma they went through. And it was very obvious that solidarity is, in that situation, that solidarity is one of the key values in Slovene society, another cornerstone for well-being. But we do also understand that we are stronger together, and collaboration with other initiatives is our priority in the field. To give you a flavor, I would just share some of our international activities. In June 2019, for instance, Slovenia was honored to host the first WHO European high-level conference on health equity in Ljubljana, with the aim to accelerating progress towards reducing health inequalities across the region. The conference concluded with a pledge from WHO European region members to prioritize reducing inequalities, focusing on social, economic, and environmental determinants, and advocating for multi-sector action and sustainable investment in health, with the statement, final one. The WHO Collaborating Center for Health and Development is based in Murska Sobota, one of the cities in the eastern region of Slovenia, which has for years contributed to the work of the WHO Office for Health and Development in Venice, in Italy, organizing workshops, trainings, intersector action, and sustainable development. We are revising the actions of that collaborative center exactly now in 2026. We have focused on securing social participation, passing a law that ensures this right, and including a regular budget for civil society and NGOs and wider social participation mechanisms. It is for that reason that we were the lead sponsor of the World Health Assembly Resolution on Social Participation in 2024, and our president has spoken in many fora, including the UN General Assembly last year, on this topic. Understanding that a health and well-being economy must be based on participatory and inclusive approaches to ensure prosperity for all in Slovenia, our president has also joined the event with Icelandic president at the Wellbeing Economy Forum in April this year in Reykjavik. We have also been strong advocates for the well-being economy internationally, being a founding member of the Wellbeing Economy Governments Initiative, co-sponsoring the World Health Assembly Resolution on the Economics of Health for All in 2024, directing a WHO collaborating center in Slovenia more towards the well-being economy. And level of governmental proactivity in the country is also, of course, depending on every individual actual government term. Slovenia is at the moment leading the sustainability work within Joint Action Prevent NCD 2024-2027 with almost 100 million euros worth initiative of 25 member states and EFTA countries coordinated by Norway. We are implementing the vision that all policy or pilot proposals developed in this joint action should be assessed for the well-being potential and recommended as such to the European Commission and member states. Today, in the times of permanent and poly crisis, we do need well-being policies and well-being approaches more than ever. It's clear that societal paradigm of constant economic growth is driving us to the wall, and well-being economy could be the political survival response for the humanity and the planet. We are keen to join scientific knowledge transfer, implementation initiatives of any kind to bring that necessary positive change to our societies. Wishing you a fruitful meeting and a lot of success to the established WHO Collaborating Center on Wellbeing and Sustainability. Congratulations, we are looking very much forward to the future initiatives and joint work.